And here's a flu-related brain teaser as you wake up this morning. Why is it important to maintain good oral health to prevent catching the flu? Dentist Dr. Doyle Williams, joins us now to talk more about this. So people think I'm crazy because I said I want a dentist on to explain preventing the flu.
The great thing about dentists as part of the oral health team is that over 120 different disease symptoms are first manifest in the mouth.
That's right. Things from like what?
Things from everything, oral cancers, the diabetes, anorexia,
wow.
Bell's palsy, just lots and lots of disease processes.
So give us some tips on how to prevent catching the H1N1 virus or seasonal flu. I know you have some things for us. You say replace your toothbrush often.
Often. So most people replace their toothbrush when they go to the dentist every 6 months. And by that time it's frayed and probably not doing a lot of good. But on the other side, there's bacteria. So with there's over 6 billion bacteria in our mouth right now. And so the toothbrush is loaded with it. And so we should really be replacing them much more often. And if you're sick, replace your toothbrush immediately after the sickness.
Of course. Now, how should you sterilize your toothbrush?
This is wonderful. So there's so many ways. You could just rinse your toothbrush, a plastic one, in water, throw it in the microwave for a minute, and it would be completely sterilized. We can boil it in water. We can put it in the dishwasher. All of these are excellent ways of sterilizing the toothbrush.
And how often should you do it?
Every day would be terrific with all of these bacteria, but at least several times a week.
So just simply pop it into the microwave. I never thought about that. Very, very interesting fact. And you say you should keep your toothbrush in a place where it's safe. Talk about that.
Yes, so toothbrushes many times are put in a brush holder next to another family member's brush. And these bacteria can be airborne, so they can easily transfer from one toothbrush to another. So if we can separate the toothbrushes, if we could make sure that they're standing upright, sometimes put a toothbrush cover over them, or many people are using power toothbrushes now that might have a sanitizer with it, which is an ultraviolet light where you can put your toothbrush and store it away safely and sterilize it at the same time.
And the last tip is, everybody's been saying good hand washing and cough etiquette. You also say that when brushing your teeth to prevent catching the flu.
Definitely. So not only do we want our hands to be clean because it's going to interact with our mouth, but we might not think of the toothpaste tube. So as we put our toothpaste on our toothbrush, we touch the bristles and would contaminate the tube of toothpaste. So just washing our hands well, put a little toothpaste on your finger and then wipe it on your brush will keep us from cross-contaminating among family members.
Oh, very good tip. Okay, let's recount for them. So first is replace your toothbrush often. As many as how many times again?
About every 3 months, and especially right after an illness.
Okay, sterilize your toothbrush, and you should do this once or twice a week. Dr. Williams also recommends store your toothbrush away from others in the house, especially when the flu is going around, and wash your hands before and after brushing. Some great anti-flu tips for us this morning, Dr. Doyle Williams. Thank you so much.
Thank you, LaToya.
Okay, and for people at home who have questions, we hope you'll join us Thursday night from 7 to 9 p.m. on NECN for H1N1, What You Need to Know. We'll be opening up the phone lines to take your questions on the swine flu with a panel of experts providing analysis. You can also email us your questions right now at any time. The address is flu@necn.com.